Good morning. We see who the early birds are. So in 45 minutes, I'm going to teach you everything you ever need to heard of about the endocrine system. Yeah, right. So this is definitely one of the organ systems that virtually everybody who ends up in our clinic has a problem with. And there's a good reason that that's the case. Because the endocrine system, not that it's more important than any other system, but it certainly is a system that is quite complicated. And it's the organ system that starts to become recruited when your immune system starts to say, oh, I can't do the job anymore. So starting as a little kid, starting as literally a baby, we know a baby really doesn't have any immune system. The first few months it's from mom's breast milk. Is about the only place that they have any immunity. Your immune system doesn't fully mature until about age 10, which is why the idea of vaccinations are like, really? We're giving something to a person who has no immune system. It's quite curious aspect of thing. So obviously it's quite complicated. It's a quite complicated system. What's even more curious is when you have a specialty in endocrinology, often they become so specialized that they only treat one of these organs. So you may have an endocrinologist who only treats their thyroid, which is like, I have no idea how he could treat one endocrine organ when this is a system that every organ interacts with every other organ. So it would take a week to talk about every organ that's in there, so that's not what's going to happen. So what is it? It's a series of glands that are located throughout your body, different parts of your body that secrete in very, very tiny amounts tissues or organs. And you have to have, in order for a cell to respond to a hormone, it has to have a receptor. So every cell sees the hormone, but only certain cells will respond if they have a specific receptor. So a lot of things will change the physiology. Some hormones work together. You need two of them to really do much. Some of them are opposite of each other, and some work better when there's another one in place. So yesterday I said one of the reasons that thyroid is best taken at nighttime is because it works with growth hormone. And growth hormone is the highest during the night, when technically your cortisol is the lowest. So, which is one of the reasons when you look at circadian rhythms, thyroid is actually better taken at nighttime, not in the morning, even though 99.9% of people are told to take it in the morning. And the main reason is the assumption is if you take it in the morning, you supposedly haven't eaten for 8 hours, or however many hours you've been sleeping. So it should be taken away from meals. And depending on the dose, it's even possible you may split the dose. Sometimes it may be in the morning, and sometimes it may be in the afternoon. So it does lots of things. It regulates most of or many of everyday organs or many functions in your body. Most people tend to know about their thyroid gland as basically being responsible for growth and energy and that type of thing. And low thyroid is certainly one of the most common problems, which is one of the things we're going to talk about. But it's also responsible for many other things that are going on, most body functions. So there's just a list of a few of the different organs that they are and what they end up doing. So technically, every endocrine gland has a specific function that's necessary for life, at least for being, in some type of a regular balance. So the two with that, yesterday we talked a lot about the adrenal gland, so I'm not going to talk about that today, but it's certainly one of the important ones, and we're going to see how it ties into thyroid. And I said yesterday that thyroid and adrenal are probably the two that are most commonly treated. The challenge is, and certainly from bioregulatory and biological medicine is when somebody has, on a lab test, low thyroid function, the assumption is we'll just support the thyroid and everything's better. But that's really not the problem, because you still have to ask, well, why is the thyroid low? That's a question that doesn't get asked. So instead, oh, here, take Synthroid if you're taking a synthetic, or take Naturothroid or Westroid or WP thyroid or whatever natural thyroid we have, or take glandulars or whatever. Now, those are supportive, but they don't really fix the problem, because you still have to figure out why does the person have a thyroid problem, which we'll talk a little more about. So what happens when your thyroid is when your endocrine system is out of balance? You now have the laundry list. Same laundry list I showed you yesterday. This is a laundry list for Lyme. This is a laundry list for hypoglycemia. This is a laundry list for Candida. This is a laundry list for everything. So you have to throw that into the mix when somebody says, oh, I have Lyme disease, potentially, which is a real thing. But have you looked at their endocrine system? Have you looked at how all the endocrine organs are interacting with each other? So we're really interested in trying to figure out why is the endocrine system out of balance. All the symptoms are the response of the endocrine system being out of balance. So it's not just about fixing that, it's about trying to understand why it's there in the first place. Everybody stayed in the rooms yesterday, so I assumed everybody saw 2 dolphins. Like, nobody left. Like, how's that? So the reality is, certainly people who go to the doctor have some degree of stress without realizing how they're supposed to manage their stress, which is certainly a reality of what we need to do. So when do people end up showing up at the doctor? Women over 40 and men over 50 is the reality. If you look at in practice, you know, who are the people who show up and they say, well, why does it take so long? Because the body does its best to try and get you to a point as it's tried to literally fix itself. But by the time, and why are women earlier? It's called menstrual cycles. Because when the menstrual cycle starts to do something different, it's like, I think something's wrong. So women generally have an earlier detection that something's wrong when their menstrual cycle isn't what it typically is. They say, gee, it's like used to be this, now it's this. And men show up over 50 because their wives finally bug them enough to say, get the hell to see somebody because you're a pest, you know, type thing. So we know that hormones have to be in balance for anything to really to work properly. James showed a slide similar to this yesterday of looking at all the disruptors of literally of multiple organ systems, and not just the endocrine system. We see the first one is the one we talked about yesterday, eating. It's a huge problem. Now, what's the biggest problem about eating in this country, do you think? Which? Rushing. Fast food, okay. Too much? Okay. See, they're all true. The biggest problem is there's no schedule. People don't eat on a schedule anymore. So, which is one of the most important things. If you want to balance an endocrine system, the first thing you need to do is eat regular meal times. Breakfast, lunch, and dinner. Now, how did we get away from that? It's called society. You know, one day you eat this time, one day you eat that time, one day you don't eat at all. One day you'd say, well, I'm going to do intermittent fasting. One day I'm only going to eat within 8 hours of the day. So you do all these types of things, and every time you change that routine, the endocrine system says, what the hell are you doing? Where's the food? Because what it wants is a routine. And routine is going to be one of the most important components of this. Toxicity has been talked about yesterday. Microbes, there's lots of microbes. I think James talked about it, or somebody talked about it yesterday with the whole idea. There's more DNA in our microbes than we have. So DNA from the microbes is probably how we've evolved as a species. And it's well known that you probably have heard of something called the bubonic plague, which was in the 1400s. And it killed like 25% of the European population in its day. People thought it must have gone on for 100 years. Only went on for 2.5 years to kill all those people. Said, well, how did it stop? The reason it stopped is because the viruses say, we're dying, we better do something about it. It's the viruses that literally changed our DNA to say, oh, I'm not going to let this thing kill me anymore, because if the person dies, I die too. So And so we're responsible. The microbes have a lot to do with how we have lived and how we evolved. And I don't know, James, somebody said yesterday what we are is we're just holding our microbes in our body. That's our purpose, to carry our microbes around, because our microbes are kind of responsible for what it is we're doing. Trauma, subluxations, geopathic, chronic disease, surgery, allergies, and iatrogenic, meaning we tried something and it didn't work. The interesting one about whether your cats, if you have a cat and it sleeps on the head of your bed, on your pillow, move your bed, because you're right on a cross line. You're going to be sleeping right exactly where the grid lines cross on the earth. So if you have trouble sleeping and you have a cat that sleeps on there, don't sleep where the cat does. For some reason, they like to sleep on those cross lines. So just turn the bed 90 degrees or turn it a different direction, put it somewhere else in the room, if that's possible in time. So there's lots of things which will disrupt in our environment. There's lots of chemicals, and we know that there's 11 million or something in our environment presently that are easily, the body said, I don't know what those are, I don't know where they came from. So one of the challenges when looking at balancing your hormones is that we often look at the specific gland, and that's where the problem comes. Because there's 7 areas that you need to really look at if you truly want to balance your endocrine system. And that's where people are not looking at enough of the different pieces. So any one of these 6 can be a problem if your endocrine system is out of balance. The assumption is that 80% of women and 60% of men have a problem, but people who show up in a clinic, it's going to be 100% that basically have some form of an imbalance in those. So, I showed that earlier, but we're not going to talk about them all. We're going to talk about these as the major players. So I feel that when you're treating somebody specifically who has an endocrine problem, you have to treat all 6 of those every time. You can't just treat somebody who's coming because they have low estrogen and progesterone. You can't just treat estrogen and progesterone. You have to treat their adrenal gland, you have to treat their thyroid gland, their pituitary, their hypothalamus, and in some way, however one decides ultimately to do that. I talked about this gland yesterday, which is totally in the middle of the brain, and it was described by Descartes in the 1600s as the center of spirituality. And it's basically, when you look at Da Vinci's man, who stands like this in the drawings, what's he standing like that for? The idea is he's bringing the energy of the universe directly into the pineal gland, which is the dead center in the middle of your head, per se. So the belief is, back even in the Middle Ages, that's the source of everything. It is right in the middle. Most people just think about it as an organ that produces melatonin, which it does, but it does so much more than that. I mentioned yesterday that it often gets calcified. Fluoride is the most common thing that they find in that calcification. So, both the dentists talked about fluoride yesterday. So it does secrete a specific hormone other than melatonin. So it has to be treated every time. In fact, you should be treating it right now, because the last thing you want is your pineal gland calcified. Because if it's calcified, you're not getting the function that you're supposed to have of doing, and it's actually one of the easier ones to treat. Now, if you want to see a 20 or 30-minute YouTube on the pineal gland, that's a great little video. It talks about the function of the pineal gland and the importance of it, and why we need to pay more attention to it when no attention is paid to it. The reason that no one ever pays attention to it, other than the fact, I'm going to go back one slide I know some people are wanting that. Let me go back. The only thing that this does is if you have a tumor somewhere in your brain, so if they've done it, what they say is the tumor is 4 millimeters or 4 centimeters lateral to the pineal gland. That's used as a marker stone. That's the only thing they talk about. It's like, it's a little more important than that, unfortunately. But that's a, I think it's about 20 minutes. It's a great little discussion of the importance of the pineal gland itself. Yeah, I mentioned yesterday about body temperature. At nighttime, your body temperature, first of all, why is the body temperature 98.6? Who came up with that fancy number? Why isn't it 100? Why isn't it 95? Why is it 98.6? Somebody just make it up? You ever thought about it? Why do we take your temperature? You go to the doctor, they take your temperature. Why do we take your temperature? See if you're in the range. But that is correct. So why is it that range? Why is it 98.6? Because you take it in the morning. It's because your enzymes that run everything in your body work the best at that temperature. That's why. So when you say, oh, you're normal, you're 97.6, you're not normal. It's 98.6. That's the temperature. So if you take your temperature and it's 97.6, you're already behind the 8 ball because your enzymes are already sluggish. They're not working as efficiently as they normally should. Toxicity is one of the most common reasons that it's low, not just because you have a low functioning thyroid gland generally. So we need to pay attention to that aspect. I told you yesterday that most of the treatment of this, how do we treat the pineal gland? Meditation? You sleep in the dark. And the dark means I can't see my hand. That dark, like pitch black. And so what's the most common feedback do you think people say when you say you sleep in the dark? What do they say? I can't find the bathroom. So you know what my response is? What do you think a blind person does? They can't find it either, but somehow they get there. So practice. Don't put your slippers in front of the path to the bathroom so you trip over them. Practice how you get there. You don't turn on the light, and of course the thing is, well, what if you have a little baby? Where's the baby sleep? Where's the dark? In the closet. They love sleeping in the closet. Where did they come from? Do you think there was light when they were in the belly? There's no light in there. If they come on into the light, said, oh my God, paparazzi, where did they all come from? Babies like the dark. So should you, because it sets your pineal gland. And what's the second part? Sleep in the dark and? Awake in the light. I live in a place where it's not a problem to have 30 minutes of sunshine every day. So even if it's overcast where you are, it still means, so the option for do people live, we'll say, more in the north than where I am, is to get an awake light. Basically, so if you have to get up at 7 in the morning, let's say, the ideal is that at 6:30 you have a light that starts to come on gradually, and by 7 o'clock your room is fully lighted. That's one of the options of trying to get light. We're talking natural light, preferably for that to happen. So ideally we should be getting 30 minutes. So the dark turns it on and the light turns it off. It's like a light switch. That's the best way to deal with the pineal gland. We know that the most common symptom is low metabolic energy, fatigue. And the two most common organs that are talked about are the idea of adrenal and thyroid, but by no means are they the only two, but they're the ones we're going to focus on. So I said you have to treat one, you have to treat them all, which is what the goal is, because you can't treat one without the other. Yesterday we talked about the importance of DHEA, which is in this. Oh, here, just another comment about cholesterol. Cholesterol is bad, right? No, it's not bad at all. In fact, cholesterol is your raw material for which you may need to make all your hormones. You're going to drive, there was a sort of a tongue-in-cheek editorial some time ago that said, well, we'll drive the cholesterol so low that we'll all become infertile. because we won't have any raw material to make hormones. So the lower you drive your cholesterol, the less raw material you have to make hormones. It's not a good idea. So pregnenolone and DHEA, which become two of the treatments that I hinted at yesterday, are how you make downstream hormones. But of course, now since you can literally take cortisol or you can take testosterone or estrogen, people say, well, who worries about pregnenolone and DHEA? If you have low downstream hormone, you better look upstream, because the problem's coming from upstream, not downstream. So, and then there was a question, what if your DHEA is high? Normally it's low because you're basically using it up. You don't have enough DHEA to make these hormones. If this is high, it's because there's all these arrows are about enzyme pathways. Something's blocking it, whether it's toxicity or heavy metals or something or other that ultimately becomes a problem. So I mentioned testing. This is just a slide to basically show you the importance of circadian rhythm of all our different hormones. So everything runs in its own schedule, so to speak. This bottom one basically is what I'm showing is this red line is normal growth hormone, and this black line is if you have no sleep. So lots of people have major insomnia problems, which majorly affects their growth hormone, which majorly affects their ability to heal. If you don't have enough growth hormone, you don't heal anything. So that's why we want cortisol low at night. We want growth hormone high. We want melatonin to be high. All those things are affecting body temperature, and they're all affecting the circadian rhythm. You see what the peak of melatonin is. Here's cortisol, peaks at a different time. This peaks early, this peaks later. Here's at nighttime, TSH, thyroid hormone. It's supposed to be highest during the night. Why? So it supports growth hormone. That's why you're supposed to take it at nighttime and not the rest of the time. I mentioned these yesterday, the 3 different types of testing. I'm not going to go over that. I showed you that this is a sort of a typical. This is an interesting one. This is a 30-day measurement of woman's menstrual cycle. If you were to do this as a saliva test, if you were to do this via blood, it would cost about $3,000. If you do it by saliva, it costs you a couple $100, because it's a lot easier to measure saliva at home than have to go to a lab and have your blood drawn every 3 days and have these things measured. So it's a pretty valuable test when we're looking to see if there's some abnormality within a hormone cycle for a woman. Thyroid came up yesterday with Allison. The whole idea, was a complete thyroid panel looked at as far as the different types of measurements. You have to take. I always believe you have to take measurements of these, whatever those are, with tongue in cheek. It's of no value to use normals. You have to use optimals. There's a whole other discussion about how you decide what's the optimal level for one individual as far as their numbers are concerned. So I never treat somebody based on simply a lab test. You have to put a lot of other things into the picture to try and incorporate that. So you probably know your thyroid is in your neck. It's this, it's not that big. It would be nice if it was that big, but sometimes it gets a lot bigger than that. Because historically, and I would bet there's a bunch of people in this room right now who have a goiter, because up to 40% of the population does at some point or other. Doesn't mean you have, Hashimoto's, or doesn't mean you have a problem. It just means your thyroid is trying to capture more iodine to make more thyroid hormone. And you have to say, well, why is it trying to make more thyroid hormone? Like, what else is out of balance? So can the goiters go away? Absolutely. Are they less than, unfortunately, it's about 0.5% of all goiters are cancer. So unfortunately, they have to be investigated, that type of thing. But for most people, the goiter is just there. It's growing, we'll say. The thyroid gland makes 2 hormones, what we call T4 and a little bit of T3. The only one that's really important is the T3, not the T4, as far as activity is concerned. Yeah, when we look at what is typically prescribed, usually what's prescribed, if it's a synthetic, is Synthroid, which is just T4. And people say, they look at the labs and say, and so TSH comes out of your brain, talks to your thyroid, tells your thyroid to make thyroid hormone, which is mostly T4, a little bit of T3, and then T3 is literally made from the conversion of T4 in the periphery. That's how we get so if you don't have enough T3, you could have plenty of T4 and still have all the symptoms of low thyroid hormone, which is definitely a problem. I mentioned yesterday, if you really need optimal cortisol function to really get a good idea, that's why you have to always look at your adrenal gland as well as your thyroid. You can't just have somebody measure your TSH or your T4 and say, oh yeah, your thyroid's okay. You need the whole picture in order to truly get a better understanding. There's a typical scenario where somebody has, high TSH, low T4, and low T3. That is what we call classic hypothyroidism. It's the most commonly diagnosed. So somebody says, oh, I'm tired and my skin is dry and I'm constipation and I have dysmenorrhea and can't lose weight. Typical symptoms of low thyroid function. And this is the typical picture that shows up on labs. However, it's not the most common picture where people will present. This is more common, what people have, is that they have normal TSH and normal T4, which are the two most common ones that are measured. And you'll never even realize that you have a thyroid problem because you're not measuring the one that really is the active one, which is this free T3. This is a very common problem. We call it functional hypothyroid. Shows up exactly the same as classic hypothyroid, but yet is not treated because people don't go far enough in the testing. And even when we test it, it's still not the answer because you still have to say, why are we not getting this conversion? And the most common reason for this conversion, not converting, is? Some of the doctors have to know the answer. No, see, it's not selenium. Selenium has a factor of going here. The problem is here with selenium. What's this problem? Of not converting T4 to T3. It's an everyday problem. It's called stress. It's called high cortisol. When your cortisol goes up, you slow down the conversion of T4 to T3. It is the most common cause of poor thyroid function, the stress. And it's mainly because of that one picture there. We're getting into this functional hypothyroid scenario. And it is usually not treated because when you do labs, the doctor will say, your TSH and your T4 look great. Did you measure T3? Oh, we don't need to measure T3. Yeah, you do need to measure T3 if you really want to figure out what's going on. So here's the idea of active hormone over here. This is, you heard somebody mention measuring reverse T3 yesterday. So I sometimes measure reverse T3. Reverse T3 is an interesting number. When reverse T3 is high, you can say, why is reverse T3 high? You'll almost guarantee your cortisol is off. Because what happens when cortisol goes up is it stimulates this enzyme which causes the T4 to go to T3. When cortisol is in the right balance, it will go from T4 through this enzyme into active hormone. So that's why we're always looking at multiple things, and we can't just be looking at one aspect of what's happening. These are lots of the other reasons. You see a lot of nutritional deficiencies. Fluoride over here, again, is another one of those problems. So fluoride is a big problem. And if you live in a city that has fluoridated water, even though you're not drinking the water, you're still getting exposed to it. Often too much, unfortunately. These are other components, heavy metals again. They were talked about yesterday, a number of conditions. This is an interesting one. Fasting and starvation. What does that suggest what you're supposed to do when you fast? Rest. And that's the biggest problem that I find that I used to fast a lot of people, but I don't do it very much anymore because, fast doesn't mean don't eat. Fast means you stop everything. Like you turn your cell phone off and you don't go to work, and basically you look at comic books all day, or you look at I Love Lucy, or look at something where you smile and are happy and you don't tell anybody, you don't answer your phone. You're truly not doing anything. You're resting your entire body. That's a fast, just not eating. Because people will go about their life and just not eat, and they say, oh man, I don't feel so good, I have a headache. I said, well, what are you doing? It's not just about not eating, which I think is it's an unfortunate misnomer. We talked about body temperature. Yesterday I showed you the one with with adrenal, where it was all zigzag. So consistently, a low thyroid person will indeed, most of the readings, and when do you take the reading? When are you supposed to take your basal body temperature reading? 30 minutes before your typical lunch, which isn't what everybody else does. Take it in the morning. Don't take it in the morning. Take it before lunch. It'll be much closer to the real number that you're looking for. And if it's consistently low before lunch, if it's 97, whatever, there is potentially the issue of thyroid being a component of that picture. So Tantera wrote a book back in the 30s and was suggested that 60% of low basal body temperature are not hypothyroid because it's more of an adrenal issue. So you should never be treated for thyroid if you have an adrenal that isn't working properly. And yet it's commonly done. It's routinely done, unfortunately. So something to be said about the gonads. Let's go backwards. Same aspect of making these hormones over here. So this, of course, is the typical phases of a menstrual cycle. There's nothing that unusual. We get a couple of spikes of LH and FSH. We have 2 spikes of estrogen, one just before ovulation and one after, and then we have a single spike of progesterone somewhere about day 22. And if we don't get this egg basically implanted into the lining of the uterus, there's a precipitous drop of progesterone ultimately, which is what results in the menstrual cycle. So, and of course, there can be all kinds of imbalances about estrogen and progesterone. And once again, when you do a reference range, a lab value, doesn't tell you much. The lab values are like this wide. It goes from like 2 to 500. Like, what the hell's the use of that? Doesn't tell you anything. So, if a woman has like a number 5 of progesterone and another one has 495, whatever it is, it's like they're both considered normal. It's not normal. I mean, you have to have a lot narrower range for these numbers to really make much sense of what's happening. What's the number 1 treatment of the menstrual cycle? It's what? How do you treat the menstrual cycle? Birth control, yeah. That's definitely the number 1 way to treat it, all right. Oh, I've seen that one before. We can treat 2 at once. We treat the pineal gland and the ovary at the same time. But there's an exception here. What's the exception? Day before, the day after, and the day of a full moon. And why are we talking about a full moon? What's supposed to happen at the full moon? Ovulation. So ideally, the cycles, they don't, of course, but and we'll call it in real time. On a new moon, a woman would menstruate. On a full moon, she would ovulate. So this obviously is the most important treatment so if any woman that I'm treating doesn't have a menstrual cycle between 26 and 30 days, we don't follow their menstrual cycle, we follow the moon cycle. We try and get them onto a moon cycle as far as menstruation is concerned, because there's a couple of other things that we will end up doing for those women. Believe it or not, it's one of the easiest ways of things you can do, and that's the cycling of seeds. Cycling of seeds and the cycling of fatty acids. So the first 2 weeks of the cycle, which basically means from day 1 to day 14, we generally are using flax, chia, or hemp seeds. They're ground up, add them to whatever you're eating, and we use fish oil or hemp oil as part of their morning routine, their daily routine. And then at the full moon, or if they're ovulating, we change the seeds, sunflower, sesame, or pumpkin seeds, and add evening primrose oil and or some fish oil. We do that for 2 weeks, and we keep rotating that 2 weeks. Just that will help 70% of women. Just that, just doing that. Sleep in the dark, except around the idea of the full moon and cycle seeds. It's been amazingly successful and it's really pretty simple. There's lots of other things that can go on there also, but that's generally what we end up doing. This was the hormonal aspects that one of my residents, probably 20 years ago, did, just looking at the different mood changes that a woman has because of hormones, the different levels of hormones throughout the cycle. So there's a very real thing called premenstrual syndrome. And you say, well, is PMS normal? Is PMS normal? No, it's not. Because if the hormones are imbalanced, there won't be, breast swelling or bloating or breast tenderness, all that kind of thing. There can be some emotional things, but that's just an indication that the hormones are not in the proper balance. That's really all we're attempting to do over time. As time goes on, as a woman ages, of course, the relative amount of estrogen and the relative amount of progesterone decreases, as it should. And then you come to a point, at some point, where you stop having a menstrual cycle. And we call it perimenopause until it's 1 year that you haven't had a menses, and after 1 year we say, oh, you're menopausal. So what's supposed to happen is you menstruate, and then one day you don't menstruate and you never menstruate again. That's what's supposed to happen. And you're not supposed to have any symptoms. Like, what? Well, why do we do bioidentical hormones? Why do women have hot flashes? Why do they have vaginal dryness? Why? Because their hormones are not in balance. Because at menopause, what's supposed to happen is your adrenal gland is supposed to pick up enough estrogen and progesterone to minimize those, because women and men have about 200 cells that have receptors for these hormones. So they're not supposed to go away. But yet the Western world is the only one that gives hormones. They don't give hormones in other parts of the world. Like, why don't they have all these problems? It's because of these imbalances of the hormones. So these are just some basic things that we'll use as far as just generally support. And surprisingly, it's one of the more one of the areas that can we more easily treat. There's a lot of different herbs, of course, that can be used to support balancing those hormones in time. Testosterone is a whole other issue that is an issue. We know that testosterone is sort of big in a society, especially for men, because we know that testosterone will drop at puberty. It does. I'm going to go backwards a sec. At puberty, it does. Keep pressing the wrong one. You are responsible for the typical changes that you see at puberty, and as an adult, it's about muscle mass, which is why people are using it to maintain muscle mass. So we have quite a wide range. Men obviously have a lot more testosterone, but women also have some testosterone. There's different surges, 8 surges a day of release of testosterone. It's not just it's there and it's steady. These things go up and down in a pretty regular rate for what's happening. So we know that it can help with libido and vital energy. For women, it basically signals also a puberty change. There's a number of receptors, of course, in the sexual areas that are helpful for that, and these are, in a man, are all your typical target organs. So it seems reasonable that we should maintain testosterone at a decent level because it has an effect on many different organs. And we know that when you measure it, for a 20-year-old versus an 80-year-old will have considerably different amount of testosterone. So should we be maintaining high levels, because these are typical symptoms that people have, which is a good reason to say, well, if I have all these symptoms, shouldn't I be... It's fun with this thing. Shouldn't we be supporting it so the 80-year-old man has the same amount of testosterone as a 20-year-old man? Not really. I mean, I don't think so, but, if you're an 80-year-old man, you may differ in that particular thought. It definitely is delivered in lots of different ways. There's some of them are some good and some not so good. We know that there's been warnings that have been placed now on the use of testosterone because it can create some problems that you don't want. Especially if a man is using it, So just touching the clothing for his partner or a child, let's say if it's a grandfather or grandchildren hugging their grandkids, can actually transfer the testosterone to literally a baby. That can be a real problem because you're basically the baby will be getting way too much testosterone. So we do know also that there's this increased risk of stroke and heart attack from an imbalance of testosterone. It does cause a whole bunch of different adverse effects, which may not be so pleasant for people. It also, then we get into the idea, what about if there's too much estrogen? Which also is something that happens in men, which for them, they're not going to be too happy about that because we have this enzyme, aromatase, which will produce enzyme where and when needed. And there's obviously, so men need estrogen, just as women need testosterone. However, too much is never a good thing, which is what we're trying to minimize and try and prevent, trying to decide whether or not it should be prescribed. So these are the typical types of things of a man who has too much estrogen. Common problems associated with that. Liver function, obesity, alcohol abuse, drug abuse. These are the causes of that happen. So that's why if anybody has had the opportunity as a physician of treating somebody with liver cancer, let's say, a man will grow tremendous breasts because their liver doesn't work and it doesn't filter out all their hormones. So because breast tissue in men and women are sensitive to that, you'll see that. So in end-stage liver failure where the liver doesn't act as a filter, you see hormone levels going quite high because they can't be filtered out by people. So it's definitely a problem over time. I can talk about that. So we know that testosterone in a woman is produced in your adrenal gland. So the whole take should be for a woman, how do I support my adrenal gland? That really is what it comes down to. Your adrenal gland is, obviously it's not the most important, it is one of the important ones, because when the adrenal gland, especially for a woman moving into menopause and perimenopause, menopause, if she moves into that in a place of balance, her menopause will be quite easy. She won't really have much problems whatsoever. The best way to support that is to have a healthy adrenal gland, whatever it is that needs to be done on that particular level. Unfortunately, testosterone will cause acne and abnormal hair growth, which isn't usually a very desirable type thing. These are everyday type things that we can do. The one thing I should have said a second ago, a woman will keep cycling for 5 years after her last bleed. So we keep cycling seeds and oils for at least 5 years after they've stopped menstruating. The only difference is if they've done enough studies, if you take the reference ranges off a graph, the numbers will stay the same, relatively speaking. There's not enough progesterone and estrogen to thicken the lining and then cause the sloughing, but there still is estrogen and progesterone for about 5 years. So I always cycle seeds in that for ideally up to 5 years. The other thing that happens, I'm going to go back a bunch of slides. I know it's not on there. When a woman reaches menopause, even though there's not enough estrogen and progesterone to create a menstrual cycle, at this point in time, we call it a secondary effect of the estrogen and progesterone. And perhaps some of you have noticed it. I noticed it before, my mentor from Europe taught me that what happens at menopause is when you're not basically able to procreate the species anymore, there's a secondary function of those hormones. And the secondary function becomes a time of heightened spiritual awareness in general. Giving hormones will blunt that, and it'll be much more difficult to be able to achieve that. So, there's something to be said about, are we really wanting to be supplementing something when we're blunting a natural reaction? So just as a point of stake. So, question and answers. Question? Yes? It's not what? That's correct. It does. And often it is, and very often you need to treat their nervous system even before you treat their endocrine system. Yeah. We definitely don't spend enough time in parasympathetic state in general. You actually sleep in total darkness because that's what supports the pineal gland. It'll support normal circadian rhythm. And then ideally, depending what your windows are like or what your bedroom is like, if you don't have moonlight coming in, for whatever reason, maybe you live beside a street light, then you have to use some type of an artificial light in the room. But it should still only be ideally those 3 days. Preventing endometrial cancer in perimenopausal women. Endometrial cancer is a 20-year process. You don't wait till perimenopause. You start at 20 years before they're in perimenopause. Cancer is not a process that just shows up. It's a 10, 20, 30-year process. So the reality is, what I say to myself, every patient I see, I treat them as if they have cancer because everybody in this room have cancer cells. We make up to 1 million a day. And 1/3 of all cancers will resorb themselves. And there's no real young people in here, but the statistics say, unfortunately, by 2050, how many people will have cancer? Everybody. By 2050, right now, it's 1 in 3 women, 1 in 2 men get cancer. By 2050, it's 100%. Pretty scary thought. So why are we waiting until somebody has cancer to say, oh, you need to treat cancer? You have to use and how do you treat cancer? You balance all their organ systems. You put them in homeostasis so that all their organ systems will take care of it in the first place. Yes, ma'am. Treating the adrenal first. The number 1 treatment of the adrenal is, I said it yesterday, routine. Breakfast, lunch, dinner, go to bed, get up. That's the number 1 treatment. Vitamin C, vitamin B, glandulars, homeopathics, those types of things are totally support. And going back to the sympathetic dominance, how do we get more into parasympathetic so we don't have to keep driving our cortisol? How do we prevent us from getting into low blood sugar problems, which drives cortisol up? So it's multiple systems, multiple approaches. I'm not a fan of using iodine, personally. I know there's sort of a mixed bag about that. If somebody has a huge goiter, I would have to do sort of an idea of that. There makes sense that in some cases that iodine, if you can't make it, so in other words, there's a block between TSH and the thyroid. In our society, unless somebody's eating zero processed food, usually it's not a problem because all processed food has iodized salt that's in it. When you see salt, it's iodized salt in a package, generally. Most people are eating, how much iodine do we need? If you read Brownstein, he says we need 12.5 milligrams. It's like just a whole lot of iodine. Yes, there's breast tissue is sensitive to that. So there's a time and place that you could think that using it. Personally, I've not found it necessary to do that, maybe because of all the other stuff that I'm doing. Maybe the reason. Yes, ma'am. 2 tablespoons of ground seeds. One more question. What I recommend for water, not tap water. It's so individual, Is it alkaline water? Is it, you need some type of a filter. Right now, what we have in our own clinic, we're using a big burqa. That you can actually carry around. You can go on hiking with it. You can put, sewer water in there, and it'll filter it. It's pretty damn clean. So, but people have all there's a whole other debate about can we alkalize your body by drinking water? And no, not my opinion. You're not going to change your pH of all organs just simply by drinking alkaline water. Drinking clean water is the most important aspect. And drinking water. First, let's drink some. And then after we drink some, which kind are we drinking? And then we filter it down. But most people just don't drink enough water. All right, I'll be back this afternoon.